as well as on audio. So if you are having your laptop open, there is a possibility that camera might fall on it, so or mobile phone for that matter. So be aware of that one. Can the recording begin, please? Thank you. Okay, ladies and gentlemen, it's 10 o'clock. Welcome to the Health and Wellbeing Board meeting on 8th of September 2022, Thursday, 10 a.m. So we have quite a lot of agenda today, action-packed, 4 major items. So before that, I would like to ask, are there any apologies for absence?
Sorry, I don't know what I've done. Morgan, David Thompson, and Councillor Leonard Thompson.
Okay, thank you. Minutes of the meeting. Are you all happy that I signed that as a true record after the meeting? Thank you very much. Disclosures of interest. So we have certain items, you looked at them. And if you have any interest to disclose, can you please do that now? Thank you. So we are on to the 4th item. Northumberland Inequalities Plan 22-23. I think there is a talk by, this is handled by Jill O'Neill. Thank you.
Thank you, Chair. Good morning, everyone. I'm delighted to be here this morning to present the Northumberland Inequalities Plan. Hopefully you've all had time to read the detail of the report, and actually most of you have been on the journey alongside me to create the plan, so you probably all know the contents as well as myself. But I've got a few slides just to run through, which will hopefully highlight some of the key points that are within the report. If I can get the top button. I'll give you a nod when I'm ready to move. So what we're going to cover, as I say, is the quite rapid journey to create the inequalities plan, starting from when Councillor Glenn Sanderson had a call to action for us and we held a summit, so talk through in brief some of that. Obviously, we came to Health and Wellbeing Board back in April, and that's where we were asked to develop a task and finish group, which was chaired by Dr. Graham Sayers. And rather than a squirrel away in a darkened room somewhere and develop the plan, we wanted to work differently. So we went out and had a number of conversations across the community with our wider stakeholder group, and now we're at the process, after doing all the analysis over July, August, we're at the process of seeking comment, discussion and ideally approval from yourselves. This morning we went to overview and scrutiny on Tuesday, and they commended the report, and we took on board comments which I'll feature as we go through the presentation. Then we'll be taking it to Cabinet as well as full council, and ideally the ask by the end of the presentation is for each organisation as part of the Health and Wellbeing Board to take it into your organisations as well. Next slide, please. Thank you. So, as you'll recall, when we came, first of all, in April, we had feedback around our Inequality Summit, which was very much that call to action. It was about how we pull together and thrive together, and we deliberately wanted to take on board that branding, because this isn't just about having a council plan, this is about having a system plan, working in equal partnership with our VCSE colleagues, our business colleagues, our NHS colleagues, as well as local government and our communities, most importantly. So we very much felt that rather than having multiple logos on the bottom, we wanted to take that thriving together approach and how we aspire to indeed thrive together. So we made sure that we had examples of best practice, so we listened to the likes of British Vault. We had examples of evidence-based practice from NHS colleagues around population health management, and very much from Northumberland Communities Together, who are walking the walk and delivering that community development approach that we want to develop at scale across Northumberland. We had Cormac Russell there as our keynote speaker, and he's actually going to be working with us over the next couple of years as our critical friend and challenge agent as we grow and continue to develop our asset-based community development model. And we also had Professor Chris Bentley there from an inequalities perspective. Thank you. So the key points that came from the Inequalities Summit, if you recall, as many of you were in attendance, was very much around improving our data and our insights, and that was a very much clear message around this is about the voice of our residents in all of this, to accompany data and to be seen as equal to the data that we generate. It's upscaling the strengths and the good practice that already happen across Northumberland from a community-centred approach, and then aligning our resources. And that's not only about funding, this is absolutely about our workforce as a shared asset and how we can build bridges and work alongside our communities. And ultimately, the key thread in the whole report is about looking at everything through a true inequalities lens, which is beyond protected characteristics, it's beyond socioeconomic, it's very much recognising our geographical diversity across Northumberland as well as our wider inclusion group. So it's our 4 domains of inequalities when we refer to everything through an inequalities lens. We also engaged and were challenged and agreed to take forward those 3 key questions that you'll see throughout the report again that Cormac challenged us with is what is that can be done by communities first and foremost, what do communities require some help with, and what is it that agencies and organisations can and should do because communities can't. And if we take that as our core principles, which I'll come on to later, then we will be going a long way forward to working differently as organisations and as workforce with our communities. And ultimately, this is about participation, not just representation. It's about us all having those wider conversations as we progress over the coming years. Thank you. So moving into the 12 locality conversations, I'm fully cognizant of the fact we could have had 20 locality conversations and we wouldn't have reached into every town, village or hamlet. We tried nonetheless as best we could within our timescales to make sure we entered into our most rural communities such as into Berwick, our coastal communities where we went into Amble, and some of our smaller communities such as Holt Whistle, as well as our large urban, more densely populated areas such as Blythe. Some of our events were really large, such as the Blythe and Cramlington ones. Some were smaller, more bespoke, but actually equally rich in data, such as the Holt Whistle event. You'll note on this slide, and you've got the larger copies in your packs, again, the 4 domains of inequalities were at the core of everything that we did. But we also very much wanted to bring economic regeneration to the fore in all of this because it aligns with our key pillars within our corporate plan of the council, but very much we wanted to bring people and place together. So it was all about our economic development and our economic regeneration as well as our social regeneration that we wanted to capture and have those wider conversations. Building on local examples of really stronger practice. So you'll see with permission, we've got Aidan in the centre there, who was our fantastic case study from Cramlington, who's been a student and is now working as an apprenticeship. And it was all about his journey and what contribution he makes to his community every day and how we can build on that because we all have Aidens or forget-me-nots, which was one of the other ones, or miners' lamps and such like. So it's about finding those strengths in our communities and working alongside as much as we can because they exist in every one of our communities. And then using key tools such as the Place Standard tool on the top right there about, again, how we think differently about people and place as a connection and creating that web to understand where our strengths and where do we need to focus more on and how mature are we in those community-centred approaches, ultimately culminating in the events about what are the top 3 things that you would like to see take place in your area as well as come forward into a county-wide inequalities plan. Thank you. So, as I've mentioned, it was this was all coordinated through a task and finish group led by Graham. We had the 12 events. This was all about walking the walk. So our exec sponsors were a combination across the VCSE, across NCC and our NHS colleagues. And that really set the tone for what we're trying to do as a collective collaboration in all of this. And huge amount of support from our Northumberland Communities Together teams, as well as our public health colleagues in the facilitation. Delighted that we had over 400 stakeholders sign up, and you could see the breadth of diversity of audience that participated, and we've had strong feedback saying that more people would have come pending on dates because a lot of this ran into the June and July into the summer period. But nonetheless, we were delighted by the diverse conversations that we were able to have with the different professional perspectives that came to the table. So the analysis and feedback happened at scale, looking at Pam in the audience there, that we rapidly looked at being able to evaluate everything over the July-August period to be able to get to the point that we're here now in September. So we did look at every single sheet of paper that was produced and all the comments that were identified for us to be able to synthesise that into a county-wide plan. But what we're also producing and will be coming out by next week is a locality newsletter across the 12 events that really highlight the diverse comments that came, and hopefully people will see and resonate what came from each locality and recognise it in the county-wide plan. So that's one product that we are about to produce and circulate. And then also we're going to be creating a webinar for those that weren't able to attend, because we had such feedback to say that people wanted to participate in the learning and understanding. We did undertake a post-event survey, and actually it was overwhelmingly positive. And interestingly, the things that were less positive was only because people said, we've been doing this for years, we're already doing this. So actually it's building on those strengths and doing it to scale. So we were delighted with that feedback. We're not sitting comfortable. This is about all how we keep going forwards, which is why we're here today and want to talk about the next steps. Thank you. So trying to bring all of this complicated work together, because we're all very busy in our own organisations, and then how do we bring this together as a live document for us as a Health and Wellbeing Board? What we've tried to create here is that the key pillars in all of this, as you'll see in the report, is the Marmot indicators. The evidence base is strong and thorough, that if we work towards the Marmot indicators that are in the second table of the report, we will be working towards addressing the gaps over the coming years. But the critical thing is, it is all about having longevity to the plan and sticking with it and not being afraid that this is going to take time and energy for us to get there. And actually the Inequalities Plan feeds into every one of our own organisations, but also when we've done a recent refresh of the Health and Wellbeing Board strategy and the development session in the July period, it's all still relevant in there. So we didn't want to recreate a Health and Wellbeing Board strategy. It's about shining a light on key elements, which is the Inequalities Plan, and how then if we keep progressing with our Health and Wellbeing Board strategy, we will be addressing inequalities. And we've got a fantastic opportunity to work stronger and further with the North of Tyne Combined Authority for areas such as inclusive growth and transport and such like. So that combined, putting communities and residents first, is the framework that we're hoping will enable us to take this forward. So if I could only have one slide, it would probably be this slide, and this is the thing that I would like everyone to ideally take forward into your own organisations. It's 5 principles and 3 questions, and if we screen all of our strategies, our plans, our actions, our workforce through this lens, then actually we will be going some way to shift that culture so that inequalities becomes everybody's business, and we have that real shared common purpose now, and it's really critical now as we deal with the cost of living crisis as well as going forward. So you'll see it is looking at everything through an inequalities lens. It's that voice of residents as powerful agents of control in their own communities. And then it's about the strengths considered first, critically, and I think this hopefully will chime and align with the ICB work. It's enhancing our service to ensure equity in access to opportunity in all we do, and closing that healthcare, public health area of work, and then really maximising our civic and statutory level responsibilities. And I think for me, Northumbria Healthcare Trust's leading the way with their community promise in that respect, around that local supply chain, local workforce, and how we invest into our local communities. So if we take all of those principles and then the 3 questions, that's again our core approach that we would like to present to you today as taking it forward. I know there's a lot of detail on these next 2 slides. I'm conscious, hopefully you've got hard copies to see it in more detail. You'll be pleased to know I'm not going to read through all the detail on that, but highlight for you that we're very cognizant of the challenges that we're facing, and in bold and underlined there is the cost of living crisis, that we are at risk of widening inequalities, and we very much want to be able to hold on to and work alongside our communities during this particularly difficult period over the next 6 to 12 months, whilst we take forward a 10-year plan around inequalities. And we know that we are better doing that together as a collective than we are as separate organisations. The key statistics speak for themselves in relation to closing the gap. Quite often Northumberland looks pretty okay when you look at Northumberland level statistics, and it can mask this huge variation that we have within our county, and that's where we want to shift some of our focus from our performance perspective and really look at how we can try and close those gaps. We'll certainly at the minute hold on to, not widen and then level off and then look to close off. Covered the approach around being community-centred, and what you'll see within the report is 5 themes of the action plan that are there for you, and under 4, the inequalities lens one, just want to particularly draw reference to 4.5, which is the subset development of a poverty and hardship action plan, and that's all about the here and now. So this isn't only about our longer term aspirations. These have got really hard, tangible outcomes that we want to work with our communities on now when things are particularly tough as we go forward. As well as I say, 6 and 7 is the Joint Health and Wellbeing Strategy and the North of Tyne Combined Authority. And then inputs is all about ourselves. This isn't always about new resource or new money. It's about using our resources that we have to best effect. And again, looking at that from an inequalities perspective and working and looking at all of the strengths and assets that we can better mobilise and think differently about within our communities. The outputs and outcomes are from 2022 to 2032, working alongside the Joint Health and Wellbeing Strategy. And as I mentioned before, the indicators are largely indicators that we can enable ourselves to compare against nationally because they are Marmot indicators, but we've also included indicators that are in our gift to look at through the likes of resident surveys and using ONS data such as what's our residents' sense of belonging in our communities, what's our residents' perspective of feeling safe in their communities, because they're really important measures for us to see how well we're doing to enable our communities to indeed live their best lives now as well as into the future. So really the last 2 slides, and this is an ask for discussion and debate today, we're asking all of you to consider how much can you take this forward into your own organisations. Should we develop a compact of some sort that we can say we're signing up to this, not just for now, not just for the next 2 years, but actually for the next 10 years. These indicators won't change. These are the inequality indicators. The evidence base is there for itself to speak, but the difference is the culture change that we want to adopt by working differently with our communities and working with our workforce and thinking about how we commission differently and how we redeploy our resources differently. So that's something for consideration to have feedback from this morning. Thank you. So just to finish off, the recommendations from the report are there for your consideration. Thanks, Chair.
Hi, Maggie Bailey from Cottonwood Cancer, but also the chair of the Northumberland Health and Wellbeing Network, VCSE organisations. I have a request, but I have a query about clarification first. So on page 13, section 4.1, under who and ownership and responsibility, you mentioned the VCSE sector. That's not mentioned anywhere else in the action plan. So I just wanted to clarify what exactly you mean by that, or who exactly. So I wasn't sure.
Thank you for that. And actually these can be adapted, because I noticed I have got, for example, Thriving Together dotted throughout, but I fully appreciate that Thriving Together isn't the full VCSE sector, so we can absolutely adapt that to make sure VCSE is threaded throughout, because it is absolutely equal in partnership to enable this to be put forward. So thank you for your comment, Maggie.
No, that's great clarification. Thanks. So my request is, Thriving Together is a fantastic network for communication, but it has 13 partnership organisations who cut across every element of VCSE community work. And I appreciate inequality is broad. However, there is a dedicated health and wellbeing network which live and breathe health inequalities every day. And under the participation, not representation point of this, we would ask that that network is actually identified alongside Thriving Together in your action plan, and we are happy to participate and commit to taking responsibility of moving this agenda forward. We think it's a brilliant agenda, but we do want to be involved and included and named as a specific network to work in it.
Fully appreciate that requirement for recognition, and it is absolutely there. And part of today is about how do we cascade this out so that everyone feels like they've got a sense of ownership of it. So it would be brilliant to talk with you outside of this meeting about how we can best do that, if that works for you.
Lovely, thank you.
Thanks, Jill. Great presentation, and fully support the piece of work, which was excellent. And actually turned around in quite a short space of time if we actually think about when the journey started with Councillor Sanderson's kind of call to arms. I suppose my big point, and we are in a health and wellbeing board, but we know that health inequalities are only 10% amenable to healthcare. That means 90% isn't related to healthcare, and I suppose the organisational sign-up is really important, but also I suspect there will be other committees in the auspices of the council that this will be relevant for, and including, I suspect, education and some private sector providers as well. So actually, I think the implications of the inequalities, both for our quality of life and workforce, are far bigger than the people just in this room, would be my only observation.
Absolutely agree, Alistair, and I think something that we are looking at doing, as you know, is broadening the membership of the Health and Wellbeing Board, and I know we're going to talk about it later and hopefully in the October meeting, how the wider determinants comes up in its priority more in this particular board, but absolutely take on board around the wider beyond just public sector as well. So at the summit we certainly had good representation from private sector, and I think that's something we can take forward through that inclusive growth work and the North of Tyne Combined Authority. So absolutely, it's not only about this board. We need to be very mindful of where else we can reach into. Thank you.
Question?
Can I just...
Yeah, please.
I just need to thank everybody for all the hard work, and especially Jill, who's everybody's put an awful lot of effort into this, but it's a tremendous piece of work, and I think it's really salient that we all commit to this as organisations to make it work, because it's a lot of work already, but there's an awful lot to do, and we have to really work as partners to do it, I think. So it's to keep the energy going and take it forward. We know that we've got an emerging, hopefully, system board for partnership working in Northumberland, and how our execs sign up and engage in the partnership working is going to be crucial to this. And I take on board exactly what Maggie said as well about the voluntary sector, and the event yesterday illustrated what a wide group of people there are involved there. So thank you very much, everybody.
Better put the microphone on. Can I just say thank you very much, Jill, especially to the public health team. I know how hard they've worked on this since the summit in March. So it's an absolutely excellent plan. Although I don't have any questions, I think life expectancy is one of the things that we need to work towards. Our residents deserve to live a long and happy life, and I hope that the inequalities plan will help to do that. I also want to just mention Northumberland Communities Together, who work so hard with our residents and highlight any issues which may come up, which we need to be aware of. Thank you very much.
Jane Lothian, Local Medical Committee. Thank you, Jill. And I take note of some, you said the only negative comments you got were, we've all been doing this, and there have been several comments in the discussion that, you know, there is an awful lot of work going on. So my question is, and obviously it's particularly from dissemination to our community services, is how, and I know you say that there are plans, but it's about the communication and follow-up and how we can turn this as a meaningful activity for our practice. I'm just saying to practices, you know, community pharmacies and general practices. So that's really, how will we follow that up? And, you know, there have been various, the problem in Northumberland is when you take it as a whole, it's pretty okay, but and the various initiatives that have been over the last 2 decades, how can we actually build on it now rather than this brilliant bit of work be just another one in the series of? Sorry, I didn't mean to sound derogatory, but it's...
No, I completely take on board your point, and the risk is that the worst case scenario is that this is seen as something novel and something new or something shiny and glossy. This is about longevity, but it's also about starting where communities are at. So where Blythe is at is very different to where Ashington is at, to where Berwick is at. And the work that we're going to be doing over the next 2 to 3 years is about developing those neighbourhood networks where they already exist, building on them, and where they're less mature, how we commence them. So one of the areas in the action plan is around workforce development and looking at asset-based community development. We're really keen to look at that from a multi-agency perspective, so the likes of social prescribers, health trainers, locality coordinators to come together to develop skills, but then to apply practice at that level of place. So it's trying to create that. But also from a practice perspective or a primary care network perspective, I came along to the PCN directors meeting. I'd be very happy, as the public health team would, to work alongside practices to make this real and tangible as practices develop their own inequalities plans. So very happy to continue that work.
But it was also, Jill, about the sort of the ongoing narrative, and so that we can track what's happening today to what's happening next year to the following year, so that we see it as a story.
Yeah.
And is somebody going to do that, to create that story?
Absolutely, that's the intention, and part of the report makes reference to a cross-party members working group, and that's going to be hopefully chaired by Councillor David Ferguson, and his intention is to get out into the community with those meetings to continue that journey of conversations at the level of place, rather than continually bringing everyone back into centre, into County Hall. Let's get out and have those meetings that are more locality based. And we said all along this was the next phase of conversation at the locality events, but what's the conversation beyond that? And that's where the report asks for permission to seek to deliver on the detail, and that's the next part. So with permission, it would be great to continue this conversation in Health and Wellbeing Board at future meetings as well, and to be held to account on that, which is what we're asking for, alongside going to full council to be held to account as well.
Yeah, if I may, just quickly. This administration have 3 clear priorities. One is value for money, second is to encourage business growth, and third is to tackle inequalities. And of those 3, I found the third the hardest to understand, how I was actually going to see progress. Because for most people, when they think about Northumberland, they think about castles and coastlines and rolling hills. They don't think about some of the issues that some of us aren't really aware exist. So it was a big step for us to take, to say we actually want to get something done here. And all I can say is to thank everybody that I'm looking at here in this meeting for their help in doing this. I made it very clear that this is something I wanted to make good progress on quickly. And what I would say is that it's an example of how this county council is running now, where a political administration says, this is what we'd like you to do, please officers go away and do and get on with this. And hey presto, within a short amount of time, so much work has been done by our officers to get us here today. All I can say is a very humble thank you to Jill and to everybody else involved in this room and elsewhere for letting this happen.
And answering all the questions. The recommendations. Yeah, are we to accept the recommendations here? The 5 recommendations are the board. Clear? Thank you. And the agenda item 5 is pharmaceutical needs assessment report, and the report is there as part of the agenda. And if you have any questions, Anne Everton will be answering.
Perhaps if I just give a brief update of
that would be very helpful, Anne. Yes.
What I have done since we presented the draft paper, draft pharmaceutical needs assessment in May, we went out to consultation as we were required to do, and as well as the official formal consultation, we also asked Healthwatch to help us actually get a patient and public perspective on what they thought about the pharmacy services that were available across the county. And thanks to all the work Healthwatch did, we got 665 responses to the consultation. And that gave us a very good overview of what the public really thinks about pharmacy services. So a big thank you to Healthwatch, who concentrated their efforts in areas which have seen a decrease in the number of pharmacies. So that was Alnwick, Hexham, Morpeth, and then we also looked at Blythe because of the closure of a GP surgery, and that might have put an extra strain on pharmacy services. But we did get responses from across the whole county, and the sort of things that we found from the Healthwatch survey was that it was the same sort of things that people are always concerned about. And I've put those in the report, and that would be that the things that patients raised were that pharmacies are busier now, that there are longer queues, that it's more difficult to get the medicines that are needed because of medicine shortages, that they're not always open at the hours that patients would find convenient. And the other very telling thing was a lot of our respondents were retired, and they said although the hours that pharmacies are open suits the retired, it might not be so convenient for those who worked. There was one thing that came up in Alnwick, which was the closure of, it wasn't the closure of the pharmacy, but the fact there was no pharmacist on duty at lunchtime, and the problems that caused for rural communities if they were dependent on bus services to come, go to the pharmacy and then get home. And we went and looked into this in more detail. So I'd like to reassure Derry that we did take on the bits that we could do. And Liz Morgan and I had a meeting with the senior managers of Boots to resolve the issue of part-time closures in Alnwick. And we were satisfied that they were taking our concerns very seriously. They have recruited more pharmacists, and that there should not be a repeat of this going forward. So things can happen, and I'm pleased to say that we feel that we have actually sorted it out. So if you get more issues, don't be afraid to bring them to the public health team, who will sort it out as best as they can. With regard to the official formal consultation, we got 12 responses, which is more than we normally do. But again, and I apologise for some of them, we got a few factual inaccuracies. They have all been corrected, including the pharmacy that's not ours, but it's got a Cramlington address, a Cramlington postcode, but it's actually part of North Tyneside. So we have got rid of that out of our responsibilities, and I do apologise for misleading everyone with that. I also apologise to the practice in Felton, which I thought had already done its move, etc. It is still operating exactly as it always has done, but I know that they have combined to provide a stronger, more focused team such that they've got cover. I think apart from that, I'm willing to take any other questions. As I say, we have corrected inaccuracies. We have taken into account every comment that was made by anybody responding, and we have either included things within the new, it's not a new PNA, but we have made revisions within the PNA to take all comments into account.
Thank you.
feedback going. Again, welcome the report, and I can understand it. A lot of the report's based on physical pharmacy provision. Some of it I completely get. For example, in Morpeth, we had 2 pharmacists run by Boots 200 yards apart. That's less of a loss of service, more of a consolidation. Where I am worried from a patient perspective is we need to think about the online offer, because whilst it sounds convenient, if you need a drug urgently, online is not there. And so we need to think about that, because the economics of it is if we lose a lot of trade to online, that actually undermines the viability of some of our physical pharmacies. If you are ill and need a prescription, you actually need to be able to walk into a pharmacy with it, and they actually survive not by their acute prescriptions but by the bulk of their day-to-day business. And I do worry that if we lose pharmacies because of the online offer, we actually end up with people actually becoming really ill and actually ending up in hospital simply because they don't get their medicines as speedily as they could, because the online service is not there where you can get it instantly. So I think that's something that we do need to think about as we go forwards, because I think it is an issue. And the second issue about the online is I still have worries as a clinician that they have no real way of looking at the compliance with medications, looking at how do you use your inhaler, being there for advice. It seems very much a remote service with very few quality caveats around it, unlike most of our physical pharmacists who are actually extremely good at looking at all of those issues, and actually can be really important. It's actually saying, well, actually this medicine, you no longer need this medicine. Actually, you're not taking the right way, which again, you don't get with online. So I think it's just important that we don't just focus on physical, but actually that virtual ward is something that's both, I can see a convenience, but also a potential threat.
I would agree with you wholeheartedly. I was heartened when I looked at the statistics in that only a very, very small percentage of patients seem to have moved over to internet pharmacies. I think a lot of people do value their local pharmacy service and want to support it. And it was one of the areas that I looked at, because I thought with the pandemic that people may have moved to internet pharmacies, but it doesn't seem to have been the case. I do know that there are still an awful lot of pressures on community pharmacy and its viability, and we expect potentially to see more closures in the future. But if it's consolidations, at least they have to come to the Health and Wellbeing Board before they are permitted. And the Health and Wellbeing Board is allowed to say that they would not permit a consolidation. But if a pharmacy goes bust and decides to close, that is another issue. And we could then declare a gap in service. So I think it's up to the Health and Wellbeing Board to be cognizant of the needs of the population and to take action when pharmacies close, and to make sure that our population is not disadvantaged. The big issue that I could potentially foresee happening is the Tesco stores. I have heard that in Hull, Tesco stores have been closing their pharmacies on a temporary basis. And that would cause us a lot of problems, because we are reliant on our Tesco stores for a lot of our out-of-hours services within rural communities. We are very dependent on the Tesco's in Hexham and Berwick to provide services past 5 o'clock or past 6 o'clock.
Chair, can I just check, is it not Health OSC rather than Health and Wellbeing Board that closures would come to?
No, it's Health and Wellbeing Board. For consolidations. But we can't do anything about a closure, because it is a commercial decision about whether a pharmacy stays open or not. The closure in Alnwick, where the 2 pharmacies were directly across the road from each other, that came as a consolidation, but it was going to close anyway, because they'd given up the site. And likewise in Morpeth, they were going to close, whether it was allowed as a consolidation or not.
Thank you, Chair. Thank you very much. It was very interesting to read. And can I thank you for mentioning Alnwick in particular, because although I'm not a county councillor for Alnwick, it was myself that a lot of my residents who live rurally contacted me about Alnwick, and said that they'd gone over, they'd waited outside in a queue, and then it had shut. And actually that's a repeat of COVID, because I actually did that in COVID, went over for a prescription, and the queue snaked right down the street, right past the banks. And then as we all got nearer to Boots, they came out and shut for lunch. So it's been pretty difficult in Alnwick, and thank you very much for mentioning that. And can I just say that because of that incident with COVID, and I didn't actually report it to Liz at that time because everyone was in disarray, but I did report it to Liz Morgan just recently when they did shut, and she took that on board straight away. Which was excellent.
Yeah, I went up to see what was going on.
Thank you so much.
Because
Thank you.
I felt it was so important, having been raised as an issue through the consultation. And I've always had that worry that Alnwick may or may not, it's on that cusp of whether it should have another pharmacy there.
Yes.
With the other pharmacy being not in the town centre. And also not being open at the weekends, that I feel that Alnwick is on that cusp of, I think it needs another pharmacy, but I don't know that it can support another pharmacy commercially, if you know what I mean.
I know exactly what you mean. And as a matter of fact, we do have a little small centre belonging to Alnwick Medical Group in Embleton Village, which is absolutely wonderful. And a lot of my residents collect their medication from there now.
Yeah.
Yeah.
I think it's about, with our rural communities, we have to find innovative and safe ways of making sure that our population can access their medicines, albeit not in the traditional ways.
Absolutely. Thank you so much.
Thank you.
Thank you, Anne. And I know, having been involved in this, how much work has gone into this. But I wanted really to bring to the attention of the committee that all the issues that are being raised and the structure of the P&A, as I understand it, is set, and it's set for quite some time ago. So it's not really able to completely address, and Anne has been very good because I've been rabbiting on for the last year about some of the issues, and I think the main thing to bring people's attention to is that we're coming to a perfect storm whereby the various regulations in relation to pharmacies and how they operate and how they can get licenses, etc., and primary care are inconsistent. And they're also inconsistent with the dispensing regulations. So these are designed for really, haven't really been overhauled in terms of how they fit together since the beginning of the NHS. That is starting to cause problems, and I think particularly in Northumberland with the issues, because we would never have thought in days gone by that pharmacies wouldn't be financially viable. That is a very real thing now, and as Alistair says, with the internet, there's lots of issues. There's also issues around GP dispensing, which technically doesn't come into this, but thank you, Anne, for including it, because it's very important in the rural area. And I think and recommendation 6, which I very much lobbied Anne to put in, about this needs in the now for us to perhaps use the value of the ICS is to plan holistically for future pharmacy services, because it is a moving target, and we were discussing just before we came in. There are changes even since this last draft, because of the changes in GP services, the changes in pharmacies. You know, and at the end of the day, if there aren't any pharmacists, they can't open. So this is a very, very real issue, and we do have to think innovatively to be able to provide these services for our particular population. So thank you very much, Anne. And
It has to be a living...
Thank you for trying to address this, but it is a very, very complex issue. It's not just about where there is a physical pharmacy, where there is a GP practice, etc.
It has to be a living document, and work should be underway already to address the needs of the change to the GP contract, which requires them to provide services over a longer period. And we've got to think, yes, if somebody comes out from a consultation and needs a prescription, where are they going to get it? Because they're going to think we're not very joined up if we haven't got the pharmacy services in place to complement the change in GP hours.
Any more questions? Thank you very much, Anne.
Thank you.
To the report. Thank you.
Can I recommend we don't publish it till the very last day, just in case there are any other big changes? And also it gives you another few weeks because you've got to republish it 3 years from the date of publication.
Thank you. Right, let's move on to the 6th item, Family Hub Development, I think. Graham, right? Graham, yeah, are you ready? Yeah, thank you.
Thank you, Chair. Good morning. I'm Graham Reiter. My substantive post is Service Director for Children's Social Care, but I'm currently also the Joint Interim Director of Children's Services. And brought this report today to advise the Health and Wellbeing Board about the development and funding of family hubs in Northumberland, and also the ask is for the board to agree with and sign up to the development of those hubs and part of the governance for that. And I think the third thing, just referencing Jill's presentation earlier on the equalities, I think as I go through some of this, the clear link with the inequalities work and developments of the family hub, I think is evident. So the family hub's development is arising from the National Best Start in Life initiative. We're fortunate in Northumberland with the strength of our current and existing early help offer, which we have maintained and developed over the years in terms of through our children's centres and our early help range of support and preventative services. And that has provided a strong basis for us to develop the partnership along the Family Hub offer. So that work has been going on for some time. But what we have been successful over summer is getting significant funding, grant funding from the government for the next 3 years to support and enhance the development of those, hence wanting to bring it here and get the partnership sign up to that. We are basing a lot of the developments around our children's centres, but I've got to say we've got a strong offer. We're integrating partnership and working across the county in a range of ways. We're co-locating in our existing children's centres partner agencies where we can, but where we haven't got those estates, there are virtual and coordinated and co-location and coordinated links being made. So we have got a comprehensive offer across the county to make sure we're developing these partnership forums in an early, in a consistent way and in a thorough way across the county for those purposes. And the importance of this is actually that we identify and meet and support needs for children and families at the earliest possible stage. That absolutely has got to be the best thing and the right thing for families. Obviously fits into equality agendas, but equally with my other elements of the service I have, for me it's really important that children get the support that they need at the early stage and that they don't escalate to statutory or high level services not necessarily unnecessarily, but if those needs could have been met earlier, that is really important that we do that effectively. And I think these developments are a real strength for us in terms of being able to offer that to our communities, our families and our children. I think in terms of the governance arrangements, the funding did come out in summer and over the summer period, which is a bit unhelpful really to be able to get around people quickly to get sign up for that. So we do need sign up promptly around that. We've already, for example, agreed that the strategic governance will be through the Director of Public Health, supported by myself, and a range of I've already got agreement from Glenn and the political side for this. But I think there is wider mapping going on around the governance, a range of activities across. For example, I'm leading a lot of work at the moment integrating adults and children's safeguarding partnership work. We're also looking at children and young people's strategic partnership work, and as part of that we're trying to look and map the governance arrangements across the piece to see where there's duplication, where we can do it more efficiently and effectively. And I think the governance here, for example, we need to have some more discussions, but I would have some initial thoughts that the family hubs developments are overseen by the Children and Young People's Strategic Partnership, but there is a more formal link into this board here with the oversight, and given that link with the inequalities work in the wider health and wellbeing agenda here. But that is some work we need to do further to clarify and maximise that. The paper itself gives some more detail about the nature of the work that we need to do and what we need to deliver. We've got evidence that we're enhancing services through this funding, not just replacing services that exist. So we've got to evidence impact and improvement and additionality through that. But from my point of view, I think this is a really positive development. The funding will help us to develop what is already a strong offer, include wider partnerships, and I think will benefit children, young people and communities very effectively. So I'm happy to take any questions or comments from colleagues. Thank you.
Not so much a question, but just to say how much I absolutely support the report coming through. And you may recall, board members, in the July meeting, we had the Children's Integration Report come through, and this is absolutely the driving force within the integration paper from a children and young people's perspective, and coming at it from that real community orientation as well. So absolutely support that, and it does feed absolutely into the inequalities plan, and also agree with Graham around the governance, and if we can try and make that more efficient and streamlined in relation to our 4 thematic groups, one of which is Best Start in Life, then with permission from the board, it's about taking that away and developing that further. So really good report, thank you.
We agreed to proceed with the funding and also support the development of governance and policies. Thank you very much. Right. Thank you. Shall we then move on to the 8th agenda number, item 8, Health and Wellbeing Board Forward Plan. So, no, 7, item 7. Sorry, apologies. Health Watch. I completely circumvented you, Derry. Sorry. Health Watch Annual Report.
Which button? The down button. Thank you. Thank you, Chair. Although I have to say, after what Anne said, I feel like you've probably already heard a lot of what I'm going to say. So thank you for that, Anne. What I'm going to do today, for those of you who don't know me, I'm Jerry Nugent. I'm the project coordinator of Health Watch. What I'm going to do today is talk about our annual report, which is the report of our statutory activities. Now, as you all know, because you are Health and Wellbeing Board, as a council, you are required to have a health watch function. All local authorities are. And I'm very pleased to say that Northumberland has been very, very committed to the health watch function. And again, we are very pleased that that continuity of that commission has happened again this year. So what I'm going to talk about, on my first slide here, I've deliberately put a signpost which covers places outside Northumberland, because a lot of what I'm going to be saying later on reflects the situation that we're now in. But what I want to absolutely say to you all is that, as ever, our focus will always be Northumberland. We will work with friends and partners outside these borders, but our focus will always be the county. Can I have the next slide, please? Oh, I can do that, can't I? Is it working? Yes, it is, thank you. So, the title of our work this year is Championing What Matters to You. And the you in this context is obviously everybody who lives and works and is part of Northumberland. But in the terms of the Health Watch context, what does it mean?
It means the things that you would expect. You know, what we do is we listen to people. That is, you know, if you look at the founding legislation about Healthwatch, that's what we're here to do. We're here to listen to patients and service users, and we do that actively. We listen, we question, we check what people have said, we analyse what people have said, and then we report that onwards. But I think some of those other things that are more subtle maybe get lost in those three things, and there are other things that I think what being a champion means. And I think in our context, as I've put there, it's working with services to encourage them to take a step back. Because especially over the last 2 years, when everyone has just been up to their ears and beyond, it is sometimes difficult to take that step back and look at the picture in the round. And I think what we've set out in the report, which is on your desk in front of you, is where we've had that ability to work to bring the public experience to services and then help you take a step back and see that bigger picture again. Because this comes to the second point on there, which again, I think if we go back to the two earlier presentations about the equalities report, but also what Anne was saying about the pharmacy needs assessment, what we're trying to do is create empathy, joint and shared understanding, because data alone will only give you half the picture. And I think what we heard very, very clearly is that from the pharmacy needs assessment is that the data will show that there is a pharmacy service in Alnwick. And what the patient or the service user experience told you was it didn't work for them because it wasn't open at lunchtime. And I think that is an absolute epitome of what Healthwatch is about. Data tells you what, we can help you understand the why. So I think that is what we've been doing, and I say that is what is being a service user champion is all about. We champion that fuller understanding of what's going on. But I'm also very, very aware that, as we all are in this room, that change takes time. In many cases, sometimes it can be swift, sometimes it's just going to take longer, and very often it takes longer. And I think this is one of the biggest challenges we face as a champion, that we gather evidence and we gather reports and we have those conversations all the time. But we are very clear, and you would have all heard me say this many times, we are not a decision maker. You are the decision makers. All we can hope to do is influence you and show you the full breadth, build that using that empathy that we've built up. Because at the end of the day, change is a partnership. It's a partnership between ourselves, all the other agencies, all the individuals we work with, but it's also a partnership with decision makers. What I would always say is that it comes down to two things. We can give you the information, but at the end of the day, the decision to act or not act is yours. So that is what we're doing. We can give you the information, but we can't make the decision for you. But what I will always say is that what we will say and come back to say is that no services can ever say that they've not been told. Because we will have told, if we've got the information and we only tell you when we've got information and when we've had feedback. We don't tell you that. I would love to be able to sit here and give you my opinion on things and how things should change, but that's not what I'm paid to do. That's not what you've commissioned Healthwatch to do. The things we tell you are the things that people are telling us. So once you've been told, you've been told. What you choose to do with it is up to you. So let's see what we said we were going to do and tell you about this year. Those of you at our AGM last year heard me talk about these things. It was amongst the myriad of things that we hear about day to day. These were the sort of big 6 things that we were planning to do and to be part of, all of which we've heard bits and pieces alluded to today. And these are all ongoing issues, and Surprise, surprise, my next slide is not going to tell you that they're all solved. If only they were. But these are the things that we said we were going to be involved with over the course of the year. So what happened? The end of life project that we worked with Northumbria, the CCG and the council on this. It was a really, really interesting piece of work, and we're pleased that that end of life strategy has now been written, and I understand it's going to be published to later in the autumn. I'm looking at Rachel for this, who was heavily involved in that. And I think it was a really, really interesting piece of work because, again, from where that came from and the discussions and where that sort of grew up from discussions at Overview and Scrutiny Committee and particular circumstances around the closure of a service, I think it was really interesting what the information that the focus groups came out with. And I think what you could clearly see was that the influence that those focus groups had, because actually what people said in the end was slightly different to where it was going to go originally. So it was an interesting piece of work, and I'll commend that to you for when that comes out. Dentistry. This was really interesting. This time last year, dental services were starting to bubble under. We were starting to pick up people coming to us and saying, oh, I'm having problems getting appointments. And then it just got hotter and hotter and hotter. And it was really interesting because, we had GP access, as you've all heard before, that was coming up. That's been an ongoing thing. Vaccine access, that was, those two things were sort of neck and neck, and then suddenly dentistry came through. And it has got a lot hotter. And I'm really pleased that Overview and Scrutiny on Tuesday actually had a presentation and a full discussion about the situation with dentistry in the county, but particularly in Berwick. Because obviously we picked up issues around what was happening in Berwick, and we worked with local members around what was happening and working with NHS England to try and get something sorted. And as I say, I think this is going to go on for a while. But again, it was one of those really interesting things where something stops, bubbles, and then it suddenly goes off. And then I think concerted effort is going to be important in that one. Home care project was a really good piece of work that we actually commissioned from Healthwatch last year. It was following up on a piece of work that we did a couple of years ago, and this was talking directly to people who were getting care at home. And again, it was picking up. It wasn't about what we'd asked people to tell us about. Was not just their experiences, because obviously COVID and everything has dislocated so much, and the structural changes and problems that the sector faces. But what we wanted them to tell us was about their aspirations and what their aspirations for being a service recipient was. And again, I would commend that report to you, all available from our website. Hard copies are available if you want them. But again, really detailed, rich information about what people's aspirations for care are, and we're having ongoing conversations with Neil and his team about that and plans for the future. So on really good piece of care. Primary care undoubtedly was one of the big issues for the year, there's been a lot of changes, a lot of proposals to change, and I think if you look in the report and see the quote in there from Dr. Munir at Valence, you will see the importance of engaging with patients, because I think his statement is just so clear where it says, okay, we may not have been able to do everything, but we have heard. And I think that was really, really important for me. And I think that's really, really important for patients to actually feel that and I'll come on to that point again later, but really important that these things aren't seen to be a done deal. And I think the conversations we've had in those other areas give rise to that as well. And I'm really pleased that some local patient participation groups are starting up again now as well. The ICS, well, what can I say? It seems to be going across everything that we are doing at the moment. I'm very pleased that the Healthwatch network across the northeastern Cumbria, so across all of the areas where all of my colleagues are actually now working together as a network. And I think this is something which is probably important for you as a health and wellbeing board, or sorry, us as a health and wellbeing board, I must remember we are a full member, to remember is that what happens here in Northumberland and how that information and the patient and service user experience needs to get fed up into the ICB. And it is why it's so important that at ICB level there is actually a Health Watch representative. As it happens, that is David Thompson. He was voted by the Health Watch Network to be our representative on that board, and he will sit on that board alongside everybody else and the voluntary sector rep. And what we've built beneath that and across the structure is a way for information to be gathered from all of the localities, all of the places, and to be fed up into the ICB. So what we do here is not going to get lost. Health Watch's voice is not going to get lost. It is going to be fed up and hopefully amplified as it goes up the system. Obviously, we've heard a lot about health inequalities and obviously the issues around coming out of COVID, and that's why we're so welcoming of the Equalities Plan and the Equalities Strategy. And as I say, what we will be doing is very much refocusing our work alongside that. This last point, I just because I think this is quite an interesting one, because it's sometimes it is what people think Health Watch do, but actually it's only part of it. But I think it's a really important part. If you look at our report, you'll see where we've resolved individual issues and problems, and it is an important part of our work, but we would see ourselves very much as part of the ecosystem of advice and information in the county. But again, a very, very important one that I would say we definitely don't do alone. So, what's coming up next? Keep a lookout. We've got 2 reports coming out in the autumn. One which again came up very, very much from what we were hearing from people. We were hearing from parents whose children experienced autism, but also they were experiencing mental health problems, and there was a real tension and problem. People weren't feeling they were getting the right service and support for their children. So we've just done a piece of work around that, and we're just doing the report which we've been talking to all the services involved in that, and before I know that we've been in contact with the teams that are providing those services, but that report will be out soon, and I think again it's a really important area, because again it's one of those things going back to saying about empathy. You know the data, but you don't know what's happening unless you ask, unless you hear what people are saying. And that goes to the next report we're doing as well, which is the experience of people with sight loss. Again, there is a very clear health pathway set down for people when you lose your sight, but actually, is that what happens? And we've been working with Vision Northumberland and their client group to hear about people's experiences, and again, very, very interesting. So we'll be doing our annual conversation. We're not doing an annual survey this year in the normal way, because simply everyone is surveying everybody at the moment. So we want to do something different, and this is part of our refocusing our work around inequalities. We want to hear from people who are not heard and may not be heard through a survey, so we're doing more focus group type work. So I think it's going to be a new way of working. We'll see what it works, see what comes out, but I'm very excited about that. And we're working with partners. So we're working with partners in the voluntary and community sector, because they are the experts. You are the people who are working with people day in and day out and saying, would your service users like to come? Can we come and talk to them? So, again, it's that partnership working that's the important way of it. So we're doing a couple of pieces of work also, hopefully developing a piece of work around social care, but we're in the middle of doing a piece of work about outpatients, and I would say anyone here at the moment who has had an outpatient appointment or has thoughts about outpatients, how they're delivered. Northumbria are currently doing a piece of work looking at that. It's called PIFU, patient-initiated follow-up, which completely changes the way round that we've all experienced outpatients. So it's about you being proactive. So what I would say is if the survey's still open, we are doing a survey on that one, do have a look at it, and we're doing that in conjunction with our colleagues in North Tyneside. And finally, you should have all received an invite to our AGM on the 19th of October. It's called All Change. Oh, what a surprise. And I am delighted, in fact beyond delighted, that Neil and Rachel are going to be our keynote speakers at that event, because what I want is for the people of Northumberland to hear from the people who are leading this, who are driving these changes, who are at the heart of it, who know, who can enthuse people about what changes are going on. Because if we want all of the things that we've said and heard about earlier in the Equalities Report, about people feeling in control and understanding and all of those things, if we want those things to change, then they have to know what's going on and how that's happening. But in addition to Neil and Rachel, I am really, this is the bit that really got me excited when I was up there a few days ago. We are also having some of the students from the college coming, who are doing health and social care course, coming just to tell us briefly at the beginning, set the scene for us, to tell us why they are pursuing a career in health and social care. Because everything we hear at the moment is that workforce is the issue. So I think hearing from young people who have made that positive choice will be a really good way to get us started. So that's all I want to say for now. I've taken up probably more of your time, but I'm more than happy to answer questions on the report or anything that I've just said.
Thank you, Derry, for the very interesting and informative presentation. Do we have any questions? Wendy, please.
Thank you, Chair. Not a question, Derry. I just wanted to tell you how much we do value Health Watch.
Thank you.
Thank you so much. And especially you, actually. You're enormously helpful and lucky to have you.
Thank you very much. I'll pass on your regards to the team. That's very good. Thank you. No?
Shall we move on? Okay. Health and Wellbeing Board forward plan. Please have a look at the future agenda meetings. If you have any suggestions or proposals to make, maybe this is the time. Jill, you want to say something, please?
Yes, it was just in light of having the Health and Wellbeing Board development session where we refreshed the strategy, and then I believe at the September meeting there was an action to take away looking at who would be the executive sponsors for the 4 thematic groups as well as the member sponsors. It would be great if we could have an agenda item in October about bringing that forward as to who they're going to be and our next steps about how we'll bring all 4 themes into our forward plan.
Right, thank you. So I think to give a background, we are revising the health and well-being strategy for the next 5 years, and there are 4 themes, and we are keeping the 4 themes. Each theme will be revised, will be modernized for a post-COVID era, and also this inequality, cost of living crisis, and everything with that in mind. So that group is going to work, and we will give more information in October. Is that correct? Yeah. Thank you. Yes, Graham.
Just for those here, the presentation about the health and wellbeing strategy and our development session that we gave last time, we're going to take that to the System Transformation Board just to improve the links there at our next meeting, which I think is next week, which Rachel is doing the agenda for. Apologies, I know some of you sit on the same meeting. But it's really just about how we operationalise some of that thinking and get to grips with some of that and start thinking about that.
Yes, I think that reminded me, I also with Derry to come up with some strategies so that we can accommodate those strategic needs when we are revising that one. So it's, I'll leave it with you, Derry.
Yes, I've already just started noting down some ideas. You'll be pleased to hear or not, I don't know.
Two business items. The first is we want to broaden the membership. I think the question came in the inequality discussion. I think Alistair pointed out only 10% is to do with the healthcare and 90% falls outside the healthcare. So with that in mind, we want to broaden membership. So for the time being, we are going to invite representatives from fire and rescue and also police. So as a kind of a chair's action, can I propose that we will invite those representatives into our board? Thank you very much. And the second thing concerns vice chair. I think traditionally we had a vice chair from clinical expertise. I'm a political person. Be here today, gone tomorrow, but we need some stability. Therefore, we need somebody with professional experience to be the vice chair. And I think Graham was the vice chair as a CCG representative or something. So now it's no longer there with the new structure coming in. So therefore, I propose that we will keep Graham as the vice chair for the foreseeable future for two reasons. For one reason, primary reason is stability, because we are going through lots of changes with the ICS. So I think his vice chair, he being the vice chair, will help us a lot in guiding through this one. So if he's, of course, willing, I propose that Graham will continue as the vice chair for the foreseeable future. Yes, thank you very much, Jeff. Thank you very much. Right. Graham, are you willing to? I asked.
Thank you, Chair. It was really that my post as clinical chair of the commissioning group no longer is in his existence, and the terms of reference state that my post as vice chair relates to that. So it was to highlight that to the committee and just make sure that everybody was in agreement for me to carry on in the interim.
Thank you.
Thank you.
Thank you very much. Meeting will be held on 13th October, 10 a.m. Thursday. Thank you all for coming. I think I declare the meeting is ended. We can stop the recording. Thank you.